It is wonderful to be here, and I'm glad that we have such a great show up today to this so important event for the Israeli ecosystem. My name is Ron, and what I will try to convey in the few minutes that we have together is where healthcare seems to be going now that, with the transformation that we're undergoing. And I'll start with this guy. I guess some of you know who this one is. This is Lee Sedol. Lee Sedol is the world champion in Go. Anybody here plays Go? It makes chess look like child play. That's the real complex game. And this guy is the world champion of so many years in Go. And he, at this point in his life, for the first time, is playing against DeepMind's AlphaGo, and he figures out that life is never going to be the same for him. This is the point he understands he's losing the game. And that is not a sentiment he's used to feel. So that feeling that everything is changing is not now only for Go players. And nowadays, when we take a look at physicians across this country, the United States, and every other country, basically, we understand that the platform is changing. This is a LinkedIn post by one of our physicians. And what he says very openly, he says, look, a patient came in. I told the patient openly, this is what the system suggests. And here's the truth. I wouldn't have ordered this test on my own. The system saw what I didn't. It saved a life. And this is now everyday reality in healthcare systems around the world, just like this. It becomes so difficult for us to provide the care that we used to provide. When I studied medicine, we had 5 medications for diabetes. Right now, there are almost 90 different agents, and the guidelines are basically about 600 pages. Anybody here remembers those 600 pages by heart? Okay, so we have a problem as physicians. And when we look at the statistics, 1 in every 4 people who goes into a hospital is being harmed because of mistakes done by physicians and nurses that are human. So basically, we understand that this is not sustainable. With the shortage of healthcare providers around the world, with the inadequacies of the system as it is, this is not the type of care that we should be aspiring for ourselves and for our families. And small changes won't cut it. We need to make major, dramatic changes. So how can a dramatic change look like, as an example? I'll talk briefly about a disease called hepatitis C. It is the major cause of liver cancer and liver cirrhosis. And it is quite often a disease that we feel that should be curable. We have now medications that can actually lead to cure in over 98% of the people who get the drugs. And the drugs are in the health basket in this country. So supposedly, we shouldn't have any problem with hepatitis C anymore. The problem is, we don't know who the patients are. Every year, Clalit scans about 50,000 people based on the best guidelines of the Ministry of Health and the CDC, and through this scanning, through these tests, we find 38 positive cases that will get the drug and will not have liver cancer and will not have liver cirrhosis, and this is great. Can we do better than this? Can we do better than 38 out of 50,000? We created an AI prediction tool based on the amounts of data that we have at Clalit. Clalit is the largest healthcare system in this country and has been collecting and presenting data for over 25 years now. And this huge amount of data allows us to do these types of predictions. So we went to 500 people that the predictive model suggested that we should approach. How many positives did we find? You would have expected less than 1 based on this statistic. But the answer is we found 38. And this means that we have been able to improve healthcare, to improve our ability to identify those patients and treat them 100-fold. How many events in your lifetime have you seen where medicine has improved 100-fold so quickly? So we provide our physicians with a superpower. This superpower allows them to see what the naked eye cannot see, and we nowadays know that AI systems can help physicians, clinicians, nurses see things that the naked eye cannot. And this is the power of AI embedded in healthcare today. So Clalit, as I said, the largest healthcare system in the country, responsible for care of over 5 million people, with 1/3 of the acute hospital beds, 14 hospitals. And finally, we can do something we never could, which is not only to identify the patient, but actually to predict the future. We can look at patients, know that something bad is going to happen to them, and find out what we can do to take them out of harm's way. This is a new type of healthcare. This is not new for us. We've been doing it for a while. This is the first time we did this, 2010. We introduced our first predictive model to identify which patients would deteriorate into end-stage renal disease. And since then, we've been doing it massively in various different clinical domains. Nowadays, at that time, it took us 1.5 years to create one predictive model. Nowadays, for example, in this work that was just published in one of the Nature journals, looking at some of our work on foundation models, we can do 1,200 different predictions in one keystroke. But it doesn't matter. It's the same principle. We have the capacity. We had the capacity when we could only work with logistic regressions, and we have this capacity now when we have the amazing power of LLMs, of foundation models, of modern AI. And this capacity to predict the future needs to be taken all the way from the bench to the bedside. That is easier said than done. Very few countries, very few organizations have been able to close this last mile and take those amazing potential inferences they show in beautiful slides, put them in practice, put them in physicians' hands, transform practice, make a difference to patients. And the key problem is that our patients, our physicians that have 8 minutes per visit, when they're brought about with all of those predictions, I'll predict you this and I'll predict that, predict cardiovascular, we'll predict cancer, we'll use, Clalit has today over 60,000 whole genome sequences of its patients and hundreds of thousands of partial sequencing of our patients. All of this data also comes into our predictive models and helps us support the decision-making for our patients. But how can the individual physician use all of this information when they have 8 minutes to deal with their patients? So you can't just have all of these dots in, you have to connect it all together into a single one-screen summary of the clinical bottom lines that the physicians can actually use. That's what we've done. That's what we've created. We've created within Clalit a tool set that allows us to predict who are the patients at risk, to identify them, to put a focus on them, and then suggest what's needed to be done, all with explainable AI that say, why is this patient at risk and why should we switch the treatment of this patient from drug A to drug B? This is not a theoretical concept. This is deployed throughout Clalit. This is the care that 5 million members get today on a daily basis. And the key thing is to get physicians' trust, because physicians justly suspect these systems, and they wouldn't want to trust them. And it took quite a lot of time to show them what we've shown in the first slide of that physician's post, that this is actually helping them, and this is well integrated into the workflows. And this is what they're saying now. Using the systems gives me the feeling that I'm finally doing what I studied for so many years. True preventive medicine. And this is the promise of AI in massive practice, just transforming not just clinical medicine, but also public health. So this system, you would say, okay, so you have what, 1,000 of these suggestions a month? I went on live radio about an hour ago, and the person on the radio, she asked me, so you have what, thousands of these happening now on a monthly basis? I said, almost. We have, in January, we've had 100,000 care transitions within Clalit that physicians have approved and turned into practice and have transformed their care. 100,000 in January. So what happened since January? Last measurement on May. 250 care transitions at Clalit for patients based on this AI system that was homegrown, and it is our own internal development team with the division of digital health and of healthcare community health and the innovation all working together and doing this. 250,000 in a month. And every time this happens, an SMS goes to our patients saying, you know, your clinician just had a consultancy with our internal AI system, and look what they have decided. They decided to change your treatment. The physician will speak with you about this. This takes guts. And this is only the beginning. We see how AI is going to further transform healthcare. This is just the very beginning. Right now, we provide the AI system with minimal autonomy. We call it the whisper. It's like Jiminy the Cricket sitting on your shoulder and telling you, you know, do this, do this. You decide as a clinician if you want to accept or not accept. But this is moving onwards. We already have systems that do some navigation, that, for instance, look at the radiologist's list of waiting tests and decide which one they will see first. That's already partial autonomy. And we're on our way to create frontliners, to create AI systems that will be able to directly discuss and potentially also make decisions. This will take some time to be fully regulated, and right now only in test and trial, but still, this is where we're going. And some of you that might be worried that tomorrow we won't need any physicians, they will all go away like travel agents did. Don't worry, this is not where it's going. It's actually the other way around. There's a paradox called the Jevons paradox that suggests when you reduce the costs of inferences, the need for them dramatically increases and you need someone to sort all of those out. And those who have made the decision to let go of too many people too quickly kind of understand now that they might not have made the best decision in the world. I'll be a little bit careful before firing all of your senior radiologists as well as the technologists in the human replacement. And I have to tell you, you can't wait until you're ready. You'll never be ready, and your clinicians are already using systems. If they are not systems that you've created, they will be using something that somebody else has created. And there's a legal creep that comes in all the time. I know that people are worried with what is called de-skilling. If our physicians will use this system a lot, their ability to do stuff will reduce. And there's evidence, beginning of evidence to show, for instance, that clinicians that have been doing colonoscopies and using AI have become less proficient in their work after several months of working with the systems. There's already clinical evidence to that. But I would say that cannot stop us. What I am more worried about when it comes to AI is that we sometimes think that the models are some kind of impartial judges that can make decisions for us and we can trust them. That is wrong. I will not go to the specific examples, but I will only tell you, remember just this point. Models are not impartial judges. Their opinions and values embedded in code, and if you did not decide on these values, somebody else decided on those for you. This is a paper from recent months in the New England that we have put forward with a whole group of people that are worried about this, and we are trying to make those occult values in models to become transparent and not as opaque as it is right now. And I urge you all to go on the website of basically the Human Values Project and try to test yourself with some of the questions that you see there on the website, and you'll be able to take part in this global effort that we're trying to synchronize values embedded in health models in order to fit our ethos as clinicians and our value set. The next problem that we have is that people come to us as C-suite decision makers and tell us, here's a beautiful AI tool. Won't you buy it and start using it tomorrow? And you say, how can I make a decision? How would I know if it's appropriate or not? We know about all of these problems. I've mentioned a few. We're not even talking about hallucinations today and the problems with modern AI systems. How do you make a decision? How do you even begin the journey to make that decision? For this purpose, at Clalit, because we've been doing AI now for over a decade, we've created one of the world's most highly cited and used AI governance system called Optica. Optica is freely available. If anybody wants to download it, to approach me if they need this. This helps health organizations do responsible AI at scale and make decisions that will not bring you and your patients into harm's way. Everybody needs to be in the table. You need to have the clinical experts, and the cyber experts, and the AI solution developers, and the people who do data in the organization can say if it's appropriate for how the model was created, and the AI team. All of these needs to take part in this process together if you want to make judicial call about which tool you can allow yourself to put into your organization and which tools you probably should not. So I'm glad to say that Clalit is now the first and only organization that I know that have a full platform that has been now validated globally, in this case by the New England, that is now ongoing and making sure that every AI tool that touches a patient in our system has gone through this meticulous process, and we're very proud of it. Everything that we do with the help of friends, and the ecosystem locally and globally is filled with amazing, talented team members, groups, startups, and global tech companies that work with us. And we would like to invite more and more of these to come and work with us. Later today, you will have the Clalit team present the Ocean. It's a new platform that we've created that allows any startup to be collaborating with Clalit, using Clalit data, and making Clalit the test ground for your startup and your ideas, and potentially providing you with some unfair advantage over your rivals. And we've heard how difficult the competition is and attaining funding is, and this could be the differentiator that would allow you the success that you need in order to make it in the tough markets today. So the way I see it, AI-enabled healthcare is the only type of sustainable healthcare, and it's good to know that until this day, it is still true that Israel is at the cutting edges of this domain and is leading globally in using AI judiciously to improve the lives of patients, of staff, and of our economy together. Thank you so much.